Assalamu alaikum and welcome to this recorded lecture on understanding and learning from error. This is a very important concept within patient safety, and only when individual healthcare workers as well as management and leadership understand this concept correctly can patient safety actually be achieved and assured. So it is a very important lecture in this. We want to understand the nature of error and how healthcare can learn from error to improve patient safety. First of all, we have to remind ourselves of what is error. A simple definition of error is doing the wrong thing when meaning to do the right thing. A more formal definition is planned sequences of mental or physical activities that fail to achieve their intended outcomes, when these failures cannot be attributed to the intervention of some chance agency. When we're talking about error, we have to, on the other hand, talk about a violation. So we want to ask ourselves or remind ourselves, because I know you're all kind of already familiar with that. So I just want to remind you, what is a violation? A violation is different from error. A violation is a deliberate deviation from an accepted protocol or standard of care. So I want you now to take a small break from this presentation or this lecture and just hit the pause button and think about a non-work related error you recently made. What was the outcome and what were the factors leading to the error? Just have a think about that. It is important to understand that error and outcome are not inextricably linked. So you can have an error without any harm to the patient, and you also can have harm without an error. Okay, so this is not so not every error leads to harm. In fact, actually, only a very small amount of errors within healthcare lead to harm of the patient, and this is good that only few errors actually lead to harm. So many errors have no consequence for the patient, as they are recognized before harm occurs, or they are not actually harmful in themselves. So we have to remind ourselves of the human factor principle, and we have to understand that error is the inevitable downside of having a brain. Okay, so of being human. So error is connected to our humanity, to our humanness. Our being human is connected to error. We cannot live without committing errors. In the context of healthcare, an error can, of course, be problematic because it can have an impact on the patient, as we kind of said before. A situation this is relatively unique to healthcare. In fact, actually, it also is true in aviation or the nuclear industry, the space kind of exploration. In all of these industries, you can have actually, they are high risk industries. You can have error leading to human to harm, but in healthcare too, error can lead to harm. So just to quickly tell you the different the reason described errors as two main categories. You can have skill-based slips or lapses. This means finally you forget something, so you have a lapse of memory. You you don't pay attention properly, so you have a slip there in the attention span. Or mistakes. And mistakes, you can have rule-based mistakes, so that you are not aware of the rules that kind of, for example, the rules of how a machine works. Or you have knowledge-based mistakes, so that you are not kind of up to date with the knowledge, or that you have gone straight into an area where your knowledge is not good enough to lead you to the correct to the correct action. So situations, there are certain situations which are associated with mistakes, or they have an increased risk of mistakes. Okay, what are these situations? We've talked about them before, and I just want you to remember which situations you will find that you have an increased risk of doing errors. These include when you're unfamiliar with the task or when you're not experienced, and especially if there's no supervision. These two characteristics have very high risk of mistakes. Shortage of time when there's time pressure, inadequate checking, poor procedures, and poor human and equipment interface. So maybe there's a complicated machine that's difficult to work and needs lots of different steps to do to work properly, can also lead to mistakes. And which individual factors contribute to error? So which factors in you as an individual make you more prone to make mistakes? Just have a quick think about this. Individual errors include limited memory capacity, and other factors are fatigue. Fatigue is very high on top of the list of factors that contribute or increase the risk of errors. Fatigue, stress, hunger, illness, language or cultural factors, or hazardous attitudes, which means that you're not kind of careful enough, that your attitude is such that you do put people at risk. So you should not forget to take care of yourself and recognize these factors within yourself. So if you're hungry, angry, late, or tired, you should halt and not carry on your action, but hold and first of all assess, are you in the right frame of mind of now kind of starting your shift and doing a complicated task? Hold. Another abbreviation that you could remember is I'm safe, and this is standing for illness, medication, stress, alcohol, fatigue, or emotion. And any of these, you have to always ask yourself, am I safe to work today? So now we've looked a little bit at how errors occur. We looked at the fact that wherever humans work, error will occur. This is inevitable. With us, we can be very proficient, experienced doctors. We are still possible. There's still a possibility we commit an error, and this is something we have to be aware of. So we know errors occur, but now, and we looked at what are the situations that errors are at higher risk to occur, and we have to be aware of them. But now we want to look at dealing with error, to look at how should we, if an error occurs, how should we deal with it? There's a traditional approach, and unfortunately this is very commonly used here in Gaza. This is to kind of find somebody to blame for the error, to tell them just try harder. Okay, the error, you did this error, it was your fault, and you have to try harder. To discipline that person, that healthcare provider, and tell them to try harder. What is the problem with this approach? Just have a think about it. What is the problem? The basic, there's several problems with this approach. And one important problem is that nobody goes to work thinking about how can I make a mistake today? No, how I really am looking forward to making my mistake today. Nobody goes to work like that. Everybody, all healthcare professionals do want to avoid mistakes. So to tell somebody when a mistake happened, try harder next time, is not really helpful, because they have tried hard when they committed the mistake. So you have to look at what made the error happen. What were the situations, the factors that contributed to the error to happen? And this is the systems approach. It's also called the new look at error. Okay, that you look at what were the factors around the healthcare professional, around the team, around the work area that actually made this error possible. In the past, errors, so a person approach sees an error principally as a product of carelessness. Okay, so then they think remedial measures that are directed at an error maker, at a singular person, or maybe sometimes a few people, is enough. So this is naming, blaming, shaming, and retraining. But really, this approach does not work, because this individual may not have thought of making that mistake. It just happened, okay, because he's a human being, and this is why mistakes happen. So you have to put in safeguards in any system. You have to put in safeguards. You have to put in you have to look at this, you have to provide a work environment where mistakes and errors are less likely to happen. So, as I said, this previous system does not work. First of all, because people do not intend to commit errors. Only they won't. It does not solve the problem if an individual is targeted and kind of identified as a person, as someone who committed a mistake, and then that individual is targeted. The problem is that the situation still remains the same, and somebody else might come and commit a similar error, because the situation has not changed. For example, if it's very busy on the ward, if there's no for example, if a drug chart was a drug was written down in the wrong way, maybe a doctor sat down at the desk to write the drug chart, and then a lot of distraction happened. They were disrupted by relatives asking questions, by other colleagues wanting things of them, and then they made a mistake in writing the drug chart. So then you go to this doctor and you blame him, and you say, oh, you try harder, you discipline him, you give him you actually affect his confidence with it. But you have not improved the situation. The only way of improving that situation and kind of helping to avoid similar errors in the future is by actually creating an area where the doctor can sit in peace and quiet to actually complete their drug charts. So if you otherwise such countermeasures, if you kind of target this doctor and tell the doctor to be more careful and try harder, then you think, I've dealt with the problem, and it creates a false sense of security. You think we have dealt with this problem, it won't happen again, which is not true. In the future, clinicians will also hide errors. So errors are kind of hidden away and not looked at. So if errors are hidden, if clinicians hide errors, they cannot learn from them. This is the problem. And the organization cannot learn from them. And also, as the last point, it may also destroy clinicians inadvertently, which is called the second victim of the error. When the clinician actually is kind of targeted in such an individual way, it will lead to the clinician to lose confidence and also become despondent. So what should be done instead? It is important to investigate why an error occurred. Okay, the more we understand how and why errors happen, the more checks and can be put in place, the more ways can be looked at to reduce recurrence. Strategies might include, and this is not an exclusive list, there's many different ways: education, new protocols, guidelines, new systems. As I said in my examples, it might include creating a new work area where clinicians can sit without distraction to write drug charts, for example. So generally, in any error, multiple factors usually contribute. And you have patient factors, provider factors, task factors, technology and tool factors. team factors, environmental factors, and organizational factors. Maybe I've left some sort of factors out, but usually to any error that happens, you have several of such categories, factors from several of such categories contributing to the error. And this is also what is kind of illustrated in this Swiss cheese model of accident causation that was kind of described by Reason. All of these cheese slices, the Swiss cheese is known to have holes in it, and when you cut slices, you find holes in different places. And each of these slides illustrated in this diagram shows a barrier through which which is put in place to remove hazards and avoid errors. But any of these barriers has a hole, and only if several of such holes can actually be passed, will actually an adverse event occur and will a patient come to harm. Okay, so mostly things happen without harm, but in some cases these holes line up and you have a chain of events that finally then lead to the harm within the patient or for the patient. Okay, so you have some active failures, you have some latent conditions, some passive failures, but there's a successive layers of defenses, barriers, and safeguards which are kind of porous, which have holes, and only if all of these are, so a chain of events happens and all of these are passed, will a loss finally occur. This is another diagram actually showing you potential adverse events and how they can be kind of prevented. You can see that maybe policy writing can be a protection, standardization and simplifying of tasks can be a protection, automation of work can be a protection, improvement to devices and architecture, so the work layout can be a protection, and all of these can kind of be protection before a potential adverse event reaches the patient. These are the defenses against error, against adverse event from potential adverse events or from potential harm. So one important task in this is incident reporting. So incident reporting is a very important part of creating a system that protects patients. Okay, so we want to look at what is incident reporting. What does it involve? So incident reporting involves the collecting and analyzing of information about any events that could have harmed or in fact did harm anyone in the organization. So this might be harm usually to patients, but it could also harm to employees or healthcare providers, cleaners, anybody could be harmed. And these events should be looked at, analyzed, and looked at why did it happen. Incident reporting is a fundamental component of an organization's ability to learn from error. So incident reporting or incident monitoring enables the organization as well as individuals to learn from mistakes. And as a consequence, it doesn't mean that all of us have to commit the same mistakes so we can learn from it. No, we can also learn from others' mistakes if these are shared and looked at in a kind of a structured way. Then, or we can also learn from other mistakes. So this is a very good way in improving an organization's patient safety record. And in the end, it also identifies error traps. So it identifies certain situations, certain locations, certain maybe times of the day when errors are more likely to happen, and identifies them and can remove them. And I know I've shown this diagram before, but it kind of just wants to show how before the incident you had a lot of kind of work flows and ways of working and a lot of errors that could happen. But after the incident, this was kind of looked at and a new, clearer pathway was kind of put in place, and now actually there's only one way. You can't completely remove incidents because, as I said before, these errors are part of human nature, so we can't completely remove them, but we can decrease their risk and make them less, also reduce the consequences to patients from them. So an organization, in order to be able to learn from error, an organization has to have a culture that promotes the learning from error, so that individuals within the organization, as well as the organization on the whole, is able to learn from error. And for this, you need culture, the culture of learning from error. So we quickly go back to think about what is culture. Culture, again, this is a definition given by Reason. Culture means shared values, to what is important, and beliefs, how things work, that interact with an organization's structure and control systems to produce behavioral norms. And it usually is when people tell you, this is how we do things around here. This is how we do things here. This is what kind of shows is the culture. So, for example, you find you come to work in a place where people do not wash their hands before they go to see the patient, and when you ask them, they say, "Oh, this is how we do things." So you can see the shared value in this organization is, the culture is, that hand hygiene is not that important. You will then maybe go to a different hospital where everybody washes their hand before they enter a patient room, and then you see this is, in this organization, the culture is that everybody should adhere to hand hygiene is very important. So you can improve. So culture might be difficult to change, but you can improve systems, and with time you will also improve culture in a workplace or in your work environment. And actually there have been brilliant improvements in especially hygiene cultures in different places recently, where people maybe in the past never used to do much hand hygiene, but with introduction, with making it easier for people, providing hand hygiene gel at every door, and then people picking it up more, actually the culture changed. Incident reporting, I just want to come back to this, as it is so important in order to know what kind of errors occur, and in order to analyze these factors that lead to error, and then after that remove these factors that actually lead to error. Okay, so incident reporting has to be anonymous. It has to provide feedback which is timely. It has to include an open acknowledgement of success resulting from incident reporting, so that people see, I have reported this incident, and as a result, this and this was changed and has improved our way of working. And also it should include near misses. So incident reporting doesn't just mean when people come to harm, it also includes near misses. Near misses are free lessons that can be learned so you have an error that occurs without harm. This is a free lesson, a near miss. Okay, and system improvements can be instituted as a result of an investigation with no cost to the patient, so without any harm having occurred. Another way of looking at error is root cause analysis, and this is usually as a fishbone model that looks at all the different levels that have led to an incident and how this can be removed. It is a very rigorous and confidential approach to answering what happened, why did it happen, what are we going to do to prevent it from happening again? And then how will we know that our actions have improved patient safety? So after we've kind of made some changes, we want to see that this also led to improvements. So we have to look at it again and put in some procedures to find out if actually it has improved our working case. So I want to just remind you of this case. We have discussed the same case before, which is patient A receives penicillin in hospital, although he is allergic to it. So the reaction might be to seek out the nurse who gave it, the doctor who prescribed it, or the pharmacist who dispensed it. What is wrong in this action with this approach? So you can say, it's the nurse's fault because they should have known this patient was allergic, or it's the doctor's fault because they have prescribed it, or it's the pharmacist's fault because they didn't check it. What is wrong with this approach? It assumes that people make mistakes on purpose. Okay? So just asking healthcare professionals to try harder does not work to improve healthcare. And punishments of individuals also does not work to improve healthcare. But we have to look for other ways of improving. So think about some measures that could have prevented similar events from happening again. Here's a list. There's many measures. The best, the easiest, maybe the most efficient measure would be that all patients who have allergies get a wristband where the allergy is written on, maybe a red wristband to kind of warn people this patient has an allergy. And then the nurse can check before they give it, or the doctor before they prescribe it. There has to be clear communication in teams, and patients should be part of the team and should be asked. So before you, for example, any drug is prescribed, the doctor should ask, do you have any allergies? And if they say, yes, I have allergy, it should be recorded on the drug chart so that the pharmacist can check if there's any allergies, or if the patient denies any allergies, it should be said no allergies known. Okay. If you're not sure, or the patient isn't sure, you can check with relatives or with colleagues and so on. And finally, clear handwriting on prescription charts is also important for good safe medicine administration. So all of us, we have talked about, there's many ways an organization can and also should prevent errors from happening. But there's also some personal error reduction strategies that all of us should employ. And these include that you should know yourself. So you have to eat well, you have to sleep well. So it's not, you can't kind of go to the sea and sit on the beach until 2:00 in the morning when your shift starts again at 8 and you have not enough sleep. This is not good. So you have to eat well, you have to sleep well, you have to look after yourself. You have to know your environment. You have to know your task that you're doing. And if you're not sure about the task, you have to get proper supervision. You have to prepare yourself and plan. What if this happens? What if that happens? Who can I call? And so on. You have to build checks in your routine. And you should always be prepared to ask if you don't know. Mental preparedness is also important to reduce errors. Okay, so you have to always assume that errors can and actually will occur. So in your career, you will commit errors. You have to therefore identify those circumstances that most likely breed error, that lead to error. And you have to have contingencies in place to cope with problems or interruptions, distractions that might lead you to commit errors. Finally, it is always good to mentally rehearse complex procedures, or mentally rehearse, for example, to mentally rehearse your reaction to certain emergencies. and so on, so that you know what should be done and in what order, that this is always something in your mind and you can always mentally kind of repeat it to yourself. Okay, so to summarize, medical error is a complex issue. It's not simple. You commit an error, it's your fault. This is not how error how we should understand error. Medical error is a complex issue. But error itself is inevitable. It's an inevitable part of the human condition. Learning from error is more productive if it is considered at an organizational level. So we all should learn from our errors as an individual, but we will benefit more if the whole organization learns from error. And root cause analysis is a highly structured system to approach to incident analysis that allows an organization, a team, as well as individuals to learn from error. Thank you very much for listening to this recorded lecture. I hope it kind of opened the doors for you to become a safe doctor, a competent as well as safe doctor in the future, and to contribute to creating safe systems in hospitals.